Congrats on your new braces. With the new braces comes a bigger responsibility. We're going to kind of go over how to take care of everything. We're going to go over a few diet restrictions and just overall general care. So starting with brushing. Brushing is going to be 3 or 4 times a day now. Once or twice is no longer going to be sufficient. When you brush, you have to use a different technique. You want to make sure that you're angling your toothbrush to go underneath the wire, making sure that it gets the in-between areas that wouldn't be gotten if you didn't. You're going to want to angle it down, and you're going to want to angle it back up in the other direction, making sure that you're getting all over. After you've done that, you can do your normal circular motion over all of the teeth. A good rule of thumb is just to do after every meal. Maybe 4 times a day doesn't work for you, but if you're eating 3 times, you should definitely be brushing 3 times. Flossing is once a day. I always say save it for the evening time because it is tedious. We have a couple different options for flossing. You've got these floss picks here that are sold at any Walmart. You can get them at Dollar Tree. They're pretty easy to find. So they are made especially for braces. They have a thin end so that way you can go up underneath the wire and do your flossing. You'll want to make sure that you go in between all of the teeth all the way to the back. We have another option here. It is the floss threader. So in your bag, you'll get the green floss threaders and a pack of floss. You'll tie it just like you would to thread a needle. And then you are going to go slowly up underneath the brackets, making sure that you don't pull or yank on anything. And then you would do your normal flossing motion under each and every one of the teeth. Okay, so you have both options. Just choose whichever one is easiest for you. Next, we have the interdental brushes. You'll have these in your bag as well. It's kind of like a toothpick for braces. So it gets out anything that might get stuck. You'll start to notice when you're eating that lettuce, bread, pepper, anything gets stuck in between the brackets. So with these, you'll just go up underneath and kind of clean those areas. I always, when I had braces, kept mine in my pocketbook. Just pull them out if you're out eating anywhere. They're a great little option. As far as wax, this is in your bag as well, and you can get it from us anytime that you need it. It's used in case you're having a poke or a stick or if just anything's uncomfortable. What you'll want to do is take it out of the package. You're going to kind of want to move it around in your hands and get it warm and pliable. That way it'll stick to whatever area you want to put it on. You want to make sure that the bracket is dry. You can use a cotton roll, just dry it off and stick the wax to that area. So, and if it's something that continues to go on, just give us a call and it'll be something that we'll fix for you here. In your bag as well will be a list of diet restrictions. You can stick this to your fridge at home and kind of follow along these guidelines. There will be things that you may have to modify that aren't on the list. Just making sure that you're staying away from things that are hard or sticky. You'll want to make sure that candies, as far as Skittles, Jolly Ranchers, that things like that are not on the menu for you anymore. If you want something sweet, you can have something like a Reese cup because it's soft in the middle. It's also not caramelized or doesn't have any nuts in it. So just read over this list, make sure that you're paying good attention to it. If you don't, you can have brackets pop off and that prolongs your treatment time because you're having to come in for repairs. And also your appointment time will be taken up fixing the bracket instead of what was supposed to be done. So just making sure that you're following the list and sticking to the things that are on here. As far as the next few days, you're going to have to adjust to the new appliances. Things might get kind of sore. Tylenol or ibuprofen is something that will be good to take. It just knocks the edge off and makes the transition easier. As far as today, you're going to want to avoid anything for the next 2 hours. Probably later on this evening, if you want to eat something, I would stick with mashed potatoes, mac and cheese, even a PB&J, something that's soft, just in case you are sore, it won't be difficult for you. In the morning, just continue to take the ibuprofen or Tylenol and stick with soft foods until you're used to everything. Congrats on your new braces. If you need anything, don't hesitate to give us a call. Welcome to the Grinz family.